Hi, I am Dr. Pramod, orthopedic surgeon at Sankalpa Hospital. Every day I meet patients who ask me, Doctor, I have severe knee pain. I have tried everything. Will I have to live with this pain forever? The answer is no, you don't have to. For more than a decade, I have helped thousands of people walk again, pain-free and with confidence. In this video, we will understand what is osteoarthritis, why it happens, what treatment options are available, and when knee replacement surgery might be the right option. We will also see real-life stories of my patients who have recovered from their knee problems. If you or someone close to you is having a knee pain, this video could be the turning point. What is osteoarthritis? Let me ask you, do you feel pain and stiffness in the knees? Or do they hurt you while walking, climbing stairs, or even while just getting up from a chair? If your answer is yes, you might be dealing with an osteoarthritis or OA for a short. Now, people often assume knee pain is just part of aging, but that pain often has a reason. To really understand what's going wrong, first we need to know how a healthy knee functions. Once we understand this, we can treat it better. How your knee works. Your knee is like a hinge joint. It connects thigh bone, femur, to your leg bone, tibia, with the kneecap in front. Between these two bones, there is a cushion called cartilage. It helps the bone glide smoothly. Around this joint is a special liquid called synovial fluid, which keeps everything lubricated just like an oil in a machine. The ligaments and the muscles hold it all together and keep it stable. Now, imagine the rubber on a tire getting worn out due to usage. That's exactly what happens to the cartilage in osteoarthritis. When that cushion thins out, the bone starts rubbing against each other. That's what causes the pain, swelling, stiffness, and even changes the shape of your knee over time. Types of knee pain. Now, not all the knee pains are the same. Some are due to the injuries like ligament tears, meniscus problems, especially in athletes. The others may be caused by inflammation like rheumatoid arthritis. But the most common reason for the long-term knee pain is osteoarthritis, especially after 40 to 50 years. Common signs of osteoarthritis. Here are the usual warning signs to watch out for. Pain while walking, bending, or even resting. The stiffness, especially in the morning or after sitting for long hours. Swelling around the knee, a grinding or a crackling sound while moving, difficulty with everyday activities like climbing stairs or getting out of the chair. If any of these sounds familiar, it's time to look deeper. Once we spot these symptoms, the next big question is, why is this happening in the first place? What causes osteoarthritis? The osteoarthritis doesn't just happen overnight. It's a gradual process, often triggered by multiple causes. Let's look at some of them. Age. As we grow older, our joints naturally wear down. Just like rubber ties wear out with use, joints also wear out. Excess weight. Every extra kilo puts 3 to 5 times more pressure on your knees. Family history. If your parents had a joint problems, you might have too. Old injuries, previous fractures or ligament tears can lead to uneven wearing out. The repetitive stress, jobs or sports involving kneeling, squatting or lifting can speed up the joint. Lack of movement. The movement nourishes the joints. Sitting too long weakens the muscles that support the joint. Now, depending upon what's causing the damage, osteoarthritis can also show up in slightly different forms. Types of osteoarthritis. Now, when we talk about osteoarthritis, there are mainly two types, primary and secondary. The primary osteoarthritis is age-related and develops gradually with wear and tear, whereas the secondary osteoarthritis happens due to a specific reason like an old injury, obesity, and infection. To give you an example, a 65-year-old lady who slowly developed knee pain over time likely to have a primary osteoarthritis, whereas a sports person who had a ligament injury at the age of 30 years and starts having a knee pain in his 40s, that's probably a secondary osteoarthritis. Knowing the type helps us to choose the right treatment. The stages of osteoarthritis. Osteoarthritis also progresses in stages. Here is a simple way to understand them. In stage 1, which is a minor osteoarthritis, the cartilage just begins to thin out, but usually there is no pain. In the next stage, that is at stage 2, that is a mild OA, that is osteoarthritis, you feel an occasional pain and stiffness, usually after an activity. Then, during the stage 3, which is moderate osteoarthritis, you will have a regular pain, swelling, and difficulty with stairs or long walks. And finally, at stage 4, which is usually called as severe osteoarthritis, there will be a constant pain, major stiffness, and a visible joint deformity. Daily living becomes an very difficulty in this stage 4. Thankfully, no matter which stage you are at, there are effective treatments that can help living with osteoarthritis. Before we talk about treatments, let me share the stories of my patients who had silently faced the problems. Mrs. Pushpalata, a homemaker in her 60s who loved cooking for her family, now finds it hard to stand for more than 10 minutes at a stretch. She feels frustrated and even helpless. Another patient, Mr. Satyanarayana, a retired employee who once walked everywhere with pride, now avoids going out because stress has become the biggest enemy. These are not rare stories. Many patients live like this for years. But you don't have to live like this. With timely diagnosis and the right care, we can change the story from struggle to strength. So now, let's look at the treatment options that are available. Treatment options, non-surgical to surgical. Thanks to modern medicine, we now have many effective treatments to manage the osteoarthritis, and many don't involve surgery at all. In fact, most people find their great relief through a clinician and a combination of non-surgical approaches. Let us go through one by one. During the stages 1 and 2, the lifestyle modification is one of the simplest yet most powerful changes in your daily habits. Reducing your body weight, adjusting to your activities like taking breaks, avoiding squatting, or using chairs instead of sitting on the floor can reduce the wear and tear. These small changes done consistently make a big difference over time. Next comes physiotherapy and exercise, which is crucial. With the right guidance, gentle stretching and strengthening exercises, which can improve the joint flexibility, reduces the knee joint stiffness, strengthen the muscle that support the knee. Don't rely on random YouTube videos. Consult a physiotherapist and get your personalized plan. Medications and topical relief. To manage pain and swelling, we may prescribe some oral medications like paracetamol or anti-inflammatory drugs, topical creams or gels that can also provide a temporary relief. They don't cure osteoarthritis but help manage flare-ups, and they should always be used under medical supervision. Injections for the joint relief. In moderate cases, that is in stage 3, injections can offer more targeted relief. Steroid injections can reduce the inflammation. The viscosupplementation adds lubrication to the joint like topping up oil in a machine. They are not permanent fixes, but they can delay the need for surgery and improve the comfort for few months. Support devices and home care. We may also suggest walking supports like a stick or a walker, braces, cushioned shoes, or orthotic inserts for support. Home remedies like warm compressors, elevation, or mild massages to relax the joint. These simple steps, when done regularly, they help to improve your quality of life. Surgical options when pain needs a permanent solution. So we have tried lifestyle changes, regular exercises, physiotherapy, and maybe even some medications or injections. But despite of all that, if the pain still is there and it's beginning to affect your walk, your sleep, or your peace of mind, that's when we start thinking about your next step, surgery. Let me be clear, surgery is never our first option. It's our last resort.